In this morning's Health Watch, coffee and prostate cancer. A new study finds men who drink 6 or more cups of coffee a day may dramatically lower their risk of developing advanced prostate cancer. Now, that form of the disease is the second leading cause of cancer death for men in the U.S. Medical correspondent Dr. Jennifer Ashton is back this morning with more on this. So how did these researchers, how did they make this correlation between drinking coffee and advanced forms of prostate cancer and the link between the two?
Well, Chris, this was a study that really looked at lifestyle modification and prostate cancer risk of developing, as you said, the most aggressive forms. It was a Harvard study funded by the National Cancer Institute. They looked at about 48,000 men, followed them for 20 years, and asked them a questionnaire about their coffee, both decaf and regular consumption. And they found a strong association between that consumption. What they found was that men who drank 1 to 3 cups of coffee a day lowered their risk of developing the deadliest form of prostate cancer by 30%. Those who drank 6 or more cups a day, Chris, lowered their risk of the most lethal form of prostate cancer by 60%.
So this is a big study done over a long period of time.
Correct.
Is it caffeine? I mean, what are the keys here?
Important limitations here. This study was based on association. It did not show a biologic cause and effect, but there are some theories. When you talk about caffeine or coffee, we know that it is a powerful antioxidant. It has powerful anti-inflammatory properties. It can affect sex hormones such as testosterone and even glucose metabolism. It's also a powerful diuretic. All of those factors may come into play, and research will definitely be ongoing to see really what is going on in terms of a mechanism.
You know, lately we've been hearing about these wonders of coffee. Are there any other diseases that coffee can play a positive effect in preventing?
That's right. We seem to hear about it all the time. And there have also been studies that show an association between caffeine consumption and reducing the risk of diabetes, of Parkinson's disease, of liver cancer, of stroke. Just last week, we saw a study come out of Sweden which showed that women who drank 5 or more cups of coffee a day lowered their risk of a particularly aggressive form of breast cancer. So again, we keep on hearing about these associations, but in terms of the mechanism, that requires a lot more research.
I know personally, I couldn't even imagine drinking 6 cups of coffee a day. There's got to be some downsides besides the jitters.
You bet there are, Chris. And actually, we have to remember caffeine is a drug. It is a powerful stimulant. It can increase your anxiety. It can cause tremors. It can cause irregular heartbeats. It can cause dehydration. So again, we say in medicine, in moderation, probably not a bad idea. When you talk about consuming 6 or more cups a day, you have to really weigh the benefits of the risks and the potential benefits.
If you're not a coffee fan, and even if you hear the results of this study, you cannot become a coffee fan. Are there any other foods or beverages out there that can reduce your risk of prostate cancer?
Well, when you talk about what's out there in terms of prostate cancer, and again, this association in reducing risk, we've heard a lot about lycopene. It's an antioxidant found in tomatoes. And you hear again about those things all the time. The results and the data are a little conflicting. They're not conclusive. What is known to reduce the risk powerfully of prostate cancer? Don't smoke, quit if you do, and exercise.
Got it. So you don't have to race out and start drinking 6 to 8 cups of coffee.
No, absolutely not. If you
yet.
Drink it, continue, but you don't necessarily have to start yet.
Okay. Dr. Ashton, good to see you this morning. Thanks again.